All right. Good afternoon, everybody. Welcome to the Madison VA Teletown Hall. While we're waiting for phones to dial, we want to provide you with some important updates from the Madison VA. First, we hope you do stay on the line with us today as we have updates on the new enhanced eligibility for emergency suicide prevention care through the recently passed Compact Act. We have another update for everybody on the new PACT Act and health benefits for toxic exposures. We have a COVID safety update and improvements we are working to make in our community care program. We also want to let veterans know that the Madison VA and clinics are hiring. If you or someone you know is looking for work and has a passion for healthcare and helping veterans, we do have a variety of jobs open right now. Visit usajobs.gov and search for Veterans Affairs jobs or call us at 608-256-1901, extension 17483 to learn more. We also always want to remind veterans that the crisis line is available nationwide by dialing 988, and for veterans, all you have to do is press 1 to get connected to crisis services. And last, we're encouraging everybody to get our most current updates by signing up for our email updates. If you go to www.va.gov/Madison Healthcare, you can scroll to the bottom of the page and subscribe to VA Madison Healthcare news and announcements. You'll get our quarterly newsletter, press releases, and other communication products as we release them. And hold 1 second. We're going to repeat those messages while we still dial the phone to dial callers, and we'll get started in just a few minutes. We're about halfway through, so we want to repeat some messages while we're waiting to begin the town hall. We do hope you stay with us today as we'll have updates on new enhanced eligibility for emergency suicide prevention care through the recently passed Compact Act. We'll have an update on the PACT Act and health benefits for toxic exposures, a COVID safety update, and improvements we're working to make in our community care program. We want all veterans to know that the Madison VA is hiring. If you or someone you know is looking for work and has a passion for healthcare and helping veterans, we have a variety of jobs open right now. Visit usajobs.gov and search for Veterans Affairs jobs or call us at 608-256-1901, extension 17483 to learn more. We also want to remind veterans the crisis line is now available nationwide by dialing 988, and for veterans, all you have to do is press 1 to get connected to crisis services. And last, we encourage you to get the most current updates from the Madison VA by signing up for our email updates. If you go to www.va.gov/Madison Healthcare, you can scroll to the bottom of the page and subscribe to our healthcare news and announcements. You'll get our quarterly newsletter, press releases, and other communication products as we release them. All right, we are near done dialing veterans, so we will go ahead and get this town hall started. Good afternoon and welcome to Madison VA Hospital's live telephone town hall. My name is Avery Benowitz. I'm the Assistant Director of the hospital, and I'll be moderating this afternoon's call. Today, we're fortunate to have a panel of Madison VA's leadership team here to answer questions. This includes our Hospital Director, John Rohr, our Acting Chief of Staff, Dr. Chris Hildebrand, Dr. Ryan Marsh, our Subject Matter Expert for Toxic Exposures, Shannon Kostek, Suicide Prevention Coordinator, our Chief of Patient Administration Service, Liana Torres, Kelly Wycolt from our Social Work Service, Randy Carter, Chief Nurse Primary Care, and Athena Pawlowski, Nurse Manager for our Southern Tier CVOCs. We do hope you stay on the line with us this afternoon, and we encourage you to participate in the question and answer session that will follow. If you'd like to ask a question, just press 0 on your phone at any point during the call, and you'll be connected with the staff person who will take your question and get you into the queue to speak with our panel. The Q&A session will be toward the end of our call, but you can press 0 to get in the queue at any time. If you do get cut off, unfortunately, there's not an easy way to rejoin the call, so please do stay on the line so you get all of our updates. We do like to start these teletown halls with a message from our hospital director, so I'll turn the floor over to our director, John Rohr.
Thanks, Abe, and thanks for all of you who are joining us today on the call. Today we do have a few updates, as Abe shared, and it's important that we take this opportunity to provide you with the latest information that we have about what's happening here at the VA while we have you on the line. But we'll aim to keep these updates short, so there's plenty of time to address your specific questions. I'm excited today that we do have several of our subject matter experts on the call to share with you. So Shannon Kostic, our suicide prevention coordinator, is going to update you on the newly passed Compact Act and enhanced emergency suicide crisis benefits. We're going to have Liana Torres and Dr. Marsh update you on the PACT Act, your benefits, and our progress in providing toxic exposure screenings. And then we're going to have a COVID safety update and a community care update from our Assistant Director, Abe Rabinowitz. Before getting to our updates, however, I do want to first acknowledge the retirement of Dr. Alan Bridges, our Chief of Staff, who leaves us after a long and storied career of 36 years in the VHA. During his career, Dr. Bridges held the positions of Chief Medical Resident, Section Chief of Rheumatology, and Chief of Medicine. His leadership of our clinical staff has been a key reason the Madison VH is one of the finest VAs in the country. We are extremely fortunate to have a deep bench of outstanding clinicians here at Madison, and our current acting Chief of Staff, Dr. Chris Hildebrand, is one of them. We are fortunate to have him serve in an acting role while we recruit for a new Chief of Staff. With that, Abe, back to you.
All right, thank you, John. And next, we're happy to have Shannon Kostak, one of our suicide prevention coordinators, here to provide an update on the recently passed Compact Act and its extension of benefits for emergency suicide prevention care to many previously ineligible and unenrolled veterans. Shannon.
Thanks, Abe. For many years now, VA has been laser-focused on prevention of veteran suicide, and the newly passed Compact Act provides another enhancement to health care benefits for at-risk veterans. Starting January 17, 2023, most veterans in acute suicidal crisis can go to a VA or community health care facility to receive free emergency services, including ambulance transportation costs, and be eligible for inpatient or crisis residential care for up to 30 days and outpatient care for up to 90 days, including social work. This change was made possible by the Veterans Compact Act of 2020. This new legislation has the potential to increase access to emergency suicide care to an additional 9 million unenrolled veterans and reduce the number of veteran suicides by offering immediate care to veterans when they are most vulnerable. This represents a tremendous opportunity for the VA and community healthcare partners to save lives by reducing any potential barriers to emergency suicide prevention services. Today, we are aiming to increase awareness of this benefit so that all veterans know that VA continues to reduce barriers to emergency suicide prevention care by expanding eligibility and reducing important financial barriers for those in suicidal crisis. Veterans need to know and to tell their friends that this new Compact Act law covers a broad spectrum of enrolled and unenrolled veterans for emergency suicide crisis care at the VA or in the community. Community hospitals do not need to be in the VA's community care network in order to be covered for services. It is critically important that veterans let the healthcare facility know that they served in the military so that they can inquire about coverage and coordinate care with VA post-crisis. We also want to remind all veterans, their caregivers, and stakeholders that emergency help is always available through the Veterans Crisis Line. Veterans can call 988 and press 1 to be connected with an emergency crisis care operator 24 hours a day, 7 days a week. Thanks, Abe, and back to you.
All right, thanks very much, Shannon. This new benefit is certainly another great asset in our long-standing fight to prevent veteran suicide. We encourage everyone on the call to spread the word to veterans and stakeholders in the community that VA will pay for emergency suicide prevention care at VA or in the community for the vast majority of enrolled or unenrolled veterans. Next up, we have a brief update on the PACT Act, and I will give that update. For those that are not yet aware, the PACT Act is a new law officially titled the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxins PACT Act, and it represents perhaps the largest expansion of health care and benefits in VA's history. The PACT Act expands and extends eligibility for VA health care for veterans with toxic exposures and veterans of the Vietnam, Gulf War, and post-9/11 eras. It adds more than 20 presumptive conditions for burn pit, Agent Orange, and other toxic exposures. It requires VA to provide toxic exposure screening to every veteran enrolled in VA healthcare. It helps improve VA research, staff education, and treatment related to toxic exposures, and it expands benefits available for illnesses resulting from toxic exposure. We know that there are millions of veterans and survivors across America who are eligible for new health care and benefits as a result of the PACT Act, and we're making every effort to ensure broad understanding of what the PACT Act includes so that everyone who is covered understands how they can access the benefits and services that they've earned. You can discuss your specific concerns or learn more about the PACT Act and apply by visiting www.va.gov/PACT, P-A-C-T, or calling 1-800-MY-VA-411 or 800-698-2411. And now I'll turn it over to Dr. Marsh for an update on our toxic exposure screening progress.
Great, thanks, Abe. So the PACT Act is a comprehensive legislation that addresses the many concerns veterans have about their military toxic exposures and the potential adverse health effects these may cause in the future. So while we don't have all the answers yet, we are dedicated to working with each veteran when they visit us to address any symptoms or conditions they have as these relate to exposures and connect them with the appropriate resource that can best assist. The toxic exposure screening of every enrolled veteran that is required by the PACT Act started on November 8th, and we have already done just around 14,000 of them. If you have not yet been screened, you should expect that before your next primary care appointment, the nursing staff will ask if you believe you have experienced any toxic exposures, including open burn pit, airborne hazards, Gulf War-related exposures, Agent Orange, radiation, Camp Lejeune, or any other exposures. This will give you an opportunity to report any concerns you might have, which will then prompt further screening either by your primary care provider or environmental health staff. This will give you an opportunity to have further conversations about any issues and again allow us to connect you with resources such as the Registry Clinic, the Veterans Benefits Administration, Toxic Exposure Navigators, or your County Veteran Service Officer. There could also be further testing or treatment if indicated by your primary care provider or a specialist if needed. We hope to use this screening process as a starting point to address any toxic exposures you may have experienced. If you have questions about toxic exposures that have not already been addressed, please reach out to your primary care team to report your concerns. Back to you, Abe.
Great. Thank you, Dr. Marsh. And now for a COVID safety update. And while COVID has moved from pandemic to endemic, and most non-healthcare businesses in our communities are operating as they were pre-COVID, with no masks required and no occupancy level limits, as a healthcare organization that treats patients with complex healthcare needs and substantial vulnerability to COVID-19, it's important we take extra precautions to ensure our hospitals do not spread COVID-19. Recently, the Veterans Health Administration just approved a new operational plan which allows facility at low and medium transmission rates to conduct risk assessments to relax masking requirements in non-clinical areas. It's important to understand that transmission levels are different from community levels, and that most counties in our catchment area have been at high to substantial transmission rates in recent months. Because transmission rates across the counties we cover are at high and substantial levels, we must continue to require masks at our main hospital and clinics to prevent the spread of COVID-19 and to keep our patients and the staff that serve them safe from exposure. Our team reviews these levels weekly and will update requirements as we can. While we must keep our existing mask requirements in place, we are taking steps to soften some of our screening protocols. Moving forward, we expect to move from an active screening process to a passive screening process. Instead of being directly asked about symptoms and having your temperature taken, we'll move to signage and soft reminders about a mask requirement. We expect this will offer a nice change for all of our veterans as you enter our hospital and clinics. In the meantime, we do ask for your continued cooperation with our masking requirements. It is a small way that all of us can help to ensure the health and safety of all of our veterans and our staff who care for them. And next, we have a brief update on our community care program. And we want to let everybody know that during COVID, our community care program began to experience significant staffing shortages. And despite efforts to increase salaries, offer recruitment and retention incentives, we haven't been able to restore staffing to needed levels to keep up with workload. Over time, these staffing gaps have created a backlog. And if you're waiting for community care, you're experiencing the impact of this problem. We continue to use all of the authority we have to work on restoring staffing levels, but we've also recently made aggressive efforts to stabilize this program. We've assigned one of our specialty nurse managers, Melissa Conover, who's on our call, to take the lead on assembling resources to work on consult reduction and process improvement. We're working with our Vision 12 network partners to use community care staff from other sites to help support our team. We're also recruiting other internal administrative support and nurse staff and training them to assist on normal duty and overtime hours to triage and schedule consults. Further, we're implementing new technology that will help make us more efficient. With these additional resources and ongoing recruitment efforts, we expect to make a meaningful impact on this backlog soon. As we work on this backlog, we are prioritizing waiting consults based on clinical urgency and by how long the consult has been waiting for service. As we work through this improvement process, we do appreciate your patience. If you're waiting for a consult, our team will get to your consult and work with you to schedule it. If you have an urgent clinical concern, please reach out to your primary care team to report it. If you can wait for your consult, we ask for your continued patience in letting us work through this as quickly as possible. Our entire leadership team is focusing on and providing resources to support this effort. We do regret any delay you've experienced or service that was less than responsive. We're working hard to get as much of this work accomplished as quickly as possible and then to return to routine, reliable service. Thank you for your patience, and if you know of any veterans or friends who would like to help work in community care, or really anywhere in our hospital or clinics, we are hiring part-time and full-time staff. You don't have to be a doctor or even have a medical background for many of our jobs, and we're looking for help in a variety of areas. We encourage you to look into job opportunities or refer people you know to usajobs.gov to evaluate open positions here at the Madison VA. Interested applicants can also call Human Resources at 608-256-1901, extension 17483. And those are our updates for today. Thank you for sticking with us and listening to all of those. We will turn to our question and answer session. And let's see. Our first question is from James. James, you have a question about the PACT Act.
Good afternoon. Thank you for holding this event. My question is regarding a letter that I received from the Veterans Department. And I'm going to skip down to, they give 5 areas where toxic exposure would be possible. And then they list some possible effects, one of them being hypertension. I contacted the Rock County office, and they basically told me that hypertension is not covered. I find it disappointing if that's so, that a letter would say that hypertension is a covered event. You know, if we put it in black and white in a letter, it should be easy for the veteran to understand it. And that's, I guess, my question.
Sure. Hey, so this is Dr. Marsh. So I'm not sure exactly which letter you're referring to, but so hypertension is what we call a presumptive condition related to Agent Orange, and that was added as part of the PACT Act. But if you didn't have Agent Orange exposure, and I don't know if you did or not, those might have been included along with the airborne hazards on the same letter. So I apologize for that confusion. Again, I'd have to see specifically what you're talking about. But if you have Agent Orange exposure, hypertension is. If you do not, then it would be one of those conditions where you'd have to talk to your CVSO about making a claim separately from the PACT Act.
Had exposure to a toxic chemical or not?
Well, to Agent Orange, or if you had other exposures. So are you a Vietnam veteran?
I am.
Okay, so if you had boots on the ground in Vietnam, hypertension is a presumptive condition. So that would be something that you would be able to make a claim for and get service connection. But that would be a little surprising. Yeah, go ahead.
In this letter, it states Thailand, Laos, Cambodia, Guam, American Samoas, Johnson Atoll. I spent time there.
Okay. We had some technical difficulties, so we've been conducting the town hall and answering your questions, but I'm afraid that none of you were on the line listening to us answer your questions. So we're going to try to get this started again. And the question that we were just addressing was a question from Richard in Lake Geneva. And Richard, if you're on the line, would you like to go ahead with your question?
Oh, I already told you what my problems were.
Oh, sir, I'm sorry. I think what was happening is you could hear us and we couldn't hear you. So if you could repeat it, we'll make sure we can answer your question directly, okay?
Oh, well, okay. I got two questions. Okay, why, now I'm a Vietnam vet. Why can't, why can't I go to any hospital that's really close to get treated for anything, Why should I have to go clear to Madison to get treated for the same thing? Now the doctors at the Madison hospital can't fix a hip any different than the ones in Elkhorn here, or any other part of my body.
Yeah, Richard, we do have eligibility for care in the community, but it's based on your drive times and also on wait times that we have for specialties that we offer. So I'm not sure how far away you live from a VA site like the Janesville Clinic or the Rockford Clinic or Madison. So that would determine your drive time eligibility. And then if you needed a service that we couldn't provide you within a specific time frame, then you would also be eligible for care in the community. So there are ways to be eligible. It's just specific to each veteran.
See, now, I live about 20 miles from the hospital, but if I have to go to Janesville, that's about 75 miles.
From which hospital, sir, do you live 20 miles from?
Elkhorn, Lakeland.
Oh, right. That's right. So anyway, are you receiving primary care from the VA?
Such as?
Do you see any doctors at the VA hospital or the VA clinics? Any clinics?
No, I don't.
Okay. Do you receive any care from us at this time at all?
Well, I get my medicines from Madison.
Okay, so that means somebody in the VA is assigned to you as a provider for you to be doing that. I believe I'm not misspeaking. And so it would be a discussion with them as far as if they would consider, if they could let you know whether or not your time or your wait time and or mileage eligible for that care in the community. So it's a contact that you have to make with them, and that will be determined.
Yeah, because my provider's in Janesville.
There you go. So they would be the ones to work with.
I have to go see her for medications once a year.
You bet. Yeah. So you contact your provider team, and they will help you and determine if you're eligible for care in the community.
Thank you very much, sir. We appreciate the question. The next question we have is from Gary. Gary, you have a question about community care.
Hello?
Yes, sir. Please go ahead with your question.
Yeah, I'm Gary. My question was about community care, and I understand you're understaffed. However, I've been waiting now 11 weeks for an authorization code. And I've contacted them twice. They're very polite, but I'm not getting answers.
Okay, Gary, we'll make sure, if you left your information with the screeners, we'll make sure to look at your individual issue. But as I mentioned in the beginning, what we're really working on right now is a comprehensive plan to address not only the responsiveness to community care, but to work down a backlog due to staffing. So we have assigned several collateral resources to help that department catch up this workload. So I'd expect that you'd hear from us soon, and that we'll take care of your consult promptly. So as we mentioned in the beginning, we recognize that there is a delay out there. We appreciate everyone's patience, and we're working diligently to try to make sure that we get all of those consults caught up, including yours.
And Gary, this is the director. I want to apologize for your wait time, as I do for every veteran on this call who is waiting for care in the community. Again, we do have a bit of a mess with our staffing, but we are working hard on that. But that's not an excuse. You all deserve to have care in a timely fashion, and that's what we're working towards. So thank you. Thank you for bringing it up.
Well,
That's okay. Sorry about that.
Yeah, we're sorry we had a little premature disconnection there, but I appreciate the question very much. Now we're going to move on to Junior from Roscoe, Illinois. Junior, you're on the call. You can ask your question.
Yes, my question is, I go to the Rockford VA clinic, and I've been hearing rumors about a possible expansion. And I was wondering if they do expand, what areas of expertise they might have. It's very convenient to go to the Rockford VA rather than to Madison. The boys treated me well at the Rockford VA, and if you could answer the question, I'd appreciate it.
Hi, my name is Rochelle, and I am the Chief of the Primary Care Service. I'm really happy to hear that you've had great service at the Rockford Clinic. We are working on the expansion there, and there are a couple of different things that are planned. When we do get the expansion, they are planning to expand some of the dental services down to the Rockford area. And also they're looking at more of a kind of a wellness center that would be in Rockford that would include things like whole health, expanding some of our whole health services, as well as our therapy services and other things down there. We're also are happy that right now we offer some cardiology and orthopedic services in Rockford, and we will possibly be expanding some of those services too.
Thanks, Rochelle. And some of those expansion projects take a little bit of time to coordinate, but we're certainly excited about the possibility of bringing more resources to Rockford, and we'll keep this group and all of our veterans updated on the process as we move forward. The next question we have is from David. And David, do you have a question about the PACT Act?
Yes. Okay. I filed my claim. Last year was a real bad year for COPD. February, COVID, then April, March again for COPD flare-up, April COPD flare-up, then June and July. I just had one Friday. What else is available for me to get treated? For a sudden flare-up?
Hey, it's David. Hey, this is Dr. Marsh. Hey, sorry, it sounds like a horrible year for you. I'm so sorry. You're always eligible for care here. You said you made a claim. What was your claim for?
Oh, that was Friday. I couldn't make it to Mass and had very difficult breathing and talking. So I had a brief, quick conversation with the nurse in Madison. He said go to a local hospital. And once I got done there, then I had to call the 72-hour report line to get cleared. Is that all I could do? I had a lot of flare-ups last year. I had an 8-month break, so I don't know when the next flare-up's going to happen.
Yeah, so it sounds like a very difficult situation. So you certainly have specialty care services through our pulmonary service who might be able to help you kind of prevent those from occurring again. There's certainly eligibilities that you have as far as getting that care locally for emergencies.
Yes.
But kind of depends on your particular situation. So it sounds like you're doing all the right things, but I think maybe talking to your primary doctor in our system to get set up with the lung doctors might be your best route.
All right. Yeah, I already did the pulmonary exam back in December, and that was actually one of the better days. They just flare up real fast. I got good days and bad days.
Mm-hmm. Yeah. Thank you for your question, sir. The next question we have is, from Bob in Janesville. Bob, you had a question about travel pay and one other about PACT Act. Would you like to go ahead with your question?
A couple of questions. One on travel pay. A lot of times when I put in for travel pay to go to the clinic here in Janesville, it'll go into manual review. I was wondering if that's because when I go to find the appointment, it lists it as Rockford, if that's what's causing the problem. And then two, on the second question is on thyroid problems. I had to have my thyroid removed back in 2014. Has that ever been put on the list as a problem with Agent Orange completely or not?
I can answer the question on travel pay first, and thank you. It sounds like you're submitting your travel claim through our BTS3 portal. And sometimes when there's any kind of discrepancy in the claim, it'll kick it so that our staff have to manually review it. So you're right, it may be that it was stating Rockford if you went to Janesville, and that has to get reviewed by one of our staff. So that would be a logical reason why that would happen.
Okay, and I do take and change the address like I was told to do, but it still goes into manual review.
Okay, I will tell you that is a new system. So sometimes with those new systems, there are other kinds of discrepancies that will make that claim go to manual review. Believe me, we would like as many as possible of these to be processed automatically because that provides a better service to everybody. So we can look into your claim and try to figure out what's going on with that. So I'll jot your name down and see what we can find out for you, okay?
Okay. All right, appreciate it.
Hey, so this is Dr. Marsh. So the thyroid problems typically, if you have Agent Orange exposure, would be covered as a presumptive condition, so those were added. There's some nuances to exactly what kind of thyroid condition you have, but certainly talking to your county veteran service officer would hopefully help with that.
Well, I had to have the thyroid removed back in 2014 because it was cancerous.
I think this would be one of those cases where you want to talk to your county veteran service officer. There's, again, different types of low thyroid levels, and I'm not sure if this particular one would be covered. That might be one of those things you have to make a claim and see.
I turned in a claim back in 2014 after the thyroid was removed, but nothing has ever been done on it as far as. But I am at 100% because of other conditions.
Oh, sure.
I'm just trying to make it easier for other veterans that's had to have something like this done.
Oh, sure. No, and I appreciate that. I think it's, there have been some changes, so it might be worth re-exploring that one.
Okay.
Okay, thank you, sir. The next question is from David in Freeport. David, please proceed with the question.
Yes, I actually have two questions. I believe one's going to be for Dr. Marsh, reference to PACT Act. I am a Gulf War era veteran. I was in Southwest Asia in the country of Turkey, but I was in Turkey prior to the Gulf War starting, and I was exposed to particulate matter like dust and a lot of sand blowing around out there. Also, I worked security forces, so I did a lot of time on the ramp. I was exposed to a lot of jet fuel fumes, diesel fuel fumes. Also, in one incident I was involved in, I was exposed to toxic burning aluminum fumes. And I do have diagnosed chronic rhinitis and am being treated for that through my VA primary care. Now, does those type of things I've been exposed to fall under the PACT Act?
Again, yes, and this is Dr. March. They would. The only thing I'm hesitating on is I'm not sure about the specific areas where you served. And those are some things that I don't quite know, so you'd have to talk to your county veteran service officer about that to kind of nail down where you were specifically and what time. But definitely the conditions you're describing would be.
Okay. My second thing is in reference to the other thing. It's about community care. I've been being treated since February of last year. I broke a left wrist and it turned into carpal tunnel. I got surgery in the community through Freeport Health Network. And since I was unable to use my left wrist and hand for several months, my right was doing the everything, and I'm right hand dominant. And that one started to go bad and caused carpal tunnel. So I had to have surgery on the right hand at the end of December. On February the 7th, I had my last post-surgery follow-up checkup with my doctor. And, you know, all along I've been getting periodic things in the mail from Community Care or Optum, who's paying the bills, and they're showing me, you know, how much is being paid. And then all of a sudden, about a week ago, I get a bill from Freeport Health Network for my last visit, which was on February the 7th. So I called the National Community Care number, explained the situation to them, and they looked it up and they said, well, your authorization expired January 29th. And I said, well, I didn't know that. And they said, well, it is a veteran's responsibility to know. And I said, well, I would have known if I would have been either, you know, mailed a letter or got a phone call and was told about it. And they also said, well, your doctor should have known and they could have continued the authorization. I said, well, hence again, if they would have been told, they could have done that. So I called the FHN billing office to discuss the bill, and they said that, well, I'm pretty much responsible for the bill, and that's what I'm trying to verify. Am I stuck with this bill that I got to pay? Or because the person at the National Community Care number told me that they cannot go back and retroactively pay that bill since it expired in January 29th, which I say again, I knew nothing about.
Hi, David. This is John with Community Care. I will pull up your information when I get back to my computer. I will take a look at your authorizations and the effective date range, and I'll talk to Vicki, the biller down at FHN, and dig a little deeper into it. If you were within the global coverage time frame after your surgery, you would have to go to FHN regardless of the end date of your authorization. So we will determine that when I talk to Vicki, and I will reach back out to you.
Okay, and actually, John, when I spoke with FHN billing, they, they were trying to, get this corrected to see if the VA was going to pay, and she actually said that she had spoken with you on the phone personally.
Well, I will clarify that with Vicki. I don't recall talking to her in the last few months, but I will reach out to her and discuss it, and I will reach back out to you here within a day or two with an answer.
Okay, she did say that she did speak with you by phone on March the 7th, if that helps you recollect anything.
Okay, perfect. I will follow up with you, David.
Thank you, David. And I know John takes a lot of these calls, and that he will follow up on yours. So appreciate the question. The next question we have is from Curtis. Curtis, you want to proceed with your question?
Yes, I don't want to feel greedy, but I've had care from the VA in Madison since 1967. Excellent care. And I transferred to Rockford mainly because of mileage and an old person not driving good. But my question was, I've had such good care and everything, but I'm on Social Security and I need dental work. And to go to a private dentist is very expensive. And that's what I was wondering. Rockford said there's no such thing as dental care through the VA. Is that correct?
No. We do have dental care, but it is pretty restricted to for eligibility reasons. So that, I think, is probably the message they were trying to say is it isn't available to all veterans. And you have to be 100% service connected, or you have to have injured from that, or sometimes if you're having a surgery and something has to be removed or done with your dental work, that'll be done. But it's not a general eligibility for all veterans, and I think that's personally, I wish it was, but it is not.
So do I. Well, we'll just wait and see. But I was just hoping to get a little help on pulling a few teeth and such. But it wasn't, it wasn't military. Nothing happened, to cause that. It's just being 77 years old. So.
Curtis, this is Kelly Whitehouse. I work in the social work office. We get this question a lot because not all veterans are eligible for dental at the VA. There is actually something called the VA Dental Insurance Program, where veterans can purchase dental insurance through either MetLife or Delta Dental at a reduced rate, and then have dental insurance to use in the community. I'm happy to I can take down your information here and mail you some information about that if you would like.
Yes, any care, Social Security doesn't give a whole lot. My mortgage is from my retirement and not a lot of extra spending money, and if I could get a few dollars to pull a tooth, that would sure help.
Sure. Sometimes there's resources in your community too, so I'm happy to even give you a call and we can chat a little bit about your situation.
All right. Well, thank you very much. The VA has been great for me, and I thank you very much.
Thank you, Curtis, and thank you, Kelly, for following up on that. Much appreciated. Our next question is from Raymond or Kathy. You have a question about a letter you received.
Yes. I'm here.
Yep, please go ahead with your question.
Okay, the letter that arrived, which another gentleman referred to on conditions that are applicable to toxic exposure. They listed in there MAGUS, MGUS, monoclonal gammopathy of undetermined origin or something. Pardon?
Significance is what you meant to say.
Right, significance. Thank you. I don't know what, my husband's on 100% disability. Now, this is something I've never heard of. I kind of read up on it. It sounds like a protein in the blood system or bone marrow. He has history of leukemia, which has not been rated as service-connected, but other disabilities have been to 100%. Now, the service officer I talked to indicated that he should be checked to determine if this is a possibility to be added to his record, because they like to know when conditions are present for all veterans, I guess, to keep track of people affected or amount of people. I don't know, number one, how we get tested for this, if we go through a primary or if we have to go through a comp and pen type thing for that, or how that happens.
This is Dr. Hildebrand. So it's actually very simple. It's a blood test. Your primary care can order that test without difficulty. I suggest that you just call in and speak with the nurse case manager or leave a message for the provider who can then order the test. And if the test is positive, then we would refer that on to our specialist. If you're already followed by our hematology service, that would be another avenue to talk to, because this may have been tested already and you may not be aware of that. So why don't you try one of those two avenues, and then if it's positive and if it needs to be listed, we can take it from there.
Okay. I can certainly do that. We have a primary appointment tomorrow. I'll check with them.
Oh, perfect. Yeah, just give her that. Give that person the letter and say, well, how do I get this tested? And if they have any problem figuring it out, they can call me directly.
Okay, what would your number directly be then?
Yeah.
Oh, I couldn't give that out. You can't give that out. You'd be inundated, I'm sure.
Your provider knows exactly how to find me.
Okay, that's fair enough. Fair enough.
Thank you.
Now, I do have one other question. With 100% disability, any of these other conditions that would arise, like now they've added in the hypertension, that doesn't increase his disability pay in any way, shape, or form, though, correct? I mean, they just like to know of the conditions that arise.
Hey, this is Dr. Marsh. So, you can't go over 100%, but typically we recommend people do claim the conditions that they have. The issue is if, God forbid, that he dies from it, then there's spousal benefits that you might be eligible for, et cetera. There may be additional benefits that someone might be eligible for. So we usually recommend if another presumptive condition to go ahead and claim it.
Okay.
Even though you're at 100%.
That makes sense because I couldn't get a straight answer from anybody on that. It's like, do we bother? Really? Again, with more stuff? But that makes sense. Okay. Appreciate that. And I appreciate all the care the VA gives to our veterans. It's been wonderful. Wonderful.
It's a pleasure. Thank you very much for that.
All right. Our next question comes from Richard in Rockford. Richard, go ahead with your question. Oh, sorry. Hold on, we had a little technical difficulty there. We're just going to swap that around. Hold on 1 second. We are still having technical difficulties. There we go. Okay, Richard from Rockford, go ahead with your question.
Yes, I was talking about my eye care. I haven't been able to see the eye doctor in over a year, and I can't get anything through because I know you're understaffed right now.
Hi, Richard. This is John with Community Care again. We do receive a large volume of eye consults to Community Care, and as they stated earlier, with the staffing issues, we are working through those eye consults. I will take down your information, and I will give you a call back this afternoon or tomorrow, and we'll get that consult rolling.
All right, John, thank you, because I talked to Community Care yesterday, and they told me they were. Okay. I was still way down the line.
Well, we'll take a look at it.
So all right. We're working when we get those kind of questions to try to disposition these as quickly as possible, and we described the effort that we're making to catch all of that work up, and we hope that all of you on the call that might be waiting for Community Care will begin seeing a much more responsive service in the coming weeks. So thank you for your question. The next question we have is from Glenn. Glenn, go ahead with your question. Glenn, are you on the line?
Yes. Hello.
Go ahead, Glenn. Thank you.
One of the questions I had is there going to be future COVID-19 boosters available for veterans?
Hi, this is Dr. Hildebrand. So we have not been given direction either through the VA or nationally as to what COVID vaccinations are going to be recommended down the road. And so if you're fully vaccinated at this point, it's sort of unknown as to what the next steps are going to be down the road. So I'm afraid I can't give you a straight answer on that.
Okay.
But if it becomes available and it is the recommendations that the VA adopts, then of course, yes, we will be providing those. But right now, as Dr. Hildebrand said, we're just in a waiting pattern.
All right.
And your other question?
My other question was about areas that are not on the list that were considered relative to the Agent Orange one of the duty stations I was at, they had it, and I know they used it, but I have no way of proving that. So, do you know, is there going to be further expanded areas that that they may put on the list, I guess, is my question.
Yeah, so this is Dr. Marsh. I have not heard of any types of expansion planned. With that said, I mean, could it happen in the future? Sure, but I have not heard of any, unfortunately.
Right. There's always research being done. There's, as you can tell by the addition of the PACT Act, there's always people looking at where these events occurred and what services our veterans deserve. So, as Dr. Marsh indicated, nothing on the horizon that we know of, but that does not mean that it won't occur sometime in the future.
All right.
Thank you for the question.
All right, I think we have time for just a couple more. The next question we have in our queue is from Loretta. Loretta, please go ahead with your question.
Thank you. My name is Loretta Sweet, and I have my care at Rockford. I have service-related chronic cystitis. So that means I get urinary tract infections at exceedingly high rate. My problem is that, first of all, I live 20 miles from Rockford. So if I feel like I have a urinary tract infection and it happens to be on a Friday, I can almost always get into the lab. They always get me in, even though there may not be appointments. I go in, give my sample. The lab sends all of their stuff to Madison. I go the entire weekend without antibiotics, and then I have to drive 20 miles one way again on Monday to get my meds. And is there not some way that they can do a dip test or something, especially because I have such a long history, of just saying, yes, when she says she's got a urinary tract infection, she has one, give her antibiotics. That's my question.
Hi, Dr. Hildebrand here, Lord. I'm sorry that you're experiencing this problem. It's actually a surprisingly common problem, and it's very difficult to live with, and I feel for your situation. Most physicians are really reticent to give antibiotics without a microbiology proof of what the bug is that's causing the infection. And that can change from infection to infection. So if they give an antibiotic by guessing, the reality is they may be missing the mark significantly and causing you more problems down the road. So most providers, even this is also the IDSA, or the Infectious Disease Society of America recommendations, is to get microbiological proof, which means a culture, which takes up to 72 hours to grow, to figure out what's causing the problem. You can be referred to urology. I would have a discussion with your primary care provider about that to see if there's another option available for you, and you may be outside the normal kind of approach in this situation. So I would suggest talking to your primary care provider about another approach to help you with this. The other thing is, on weekends, you are covered for urgent care and emergency room visits, and I suggest you call telephone triage, and they can help direct you to document, first of all, that you're going there so that you can get it covered, and secondly, to assist you with the follow-up that's needed within the VA.
Thank you very much, Doctor.
Yeah,
I'm sorry.
Yeah, I failed to tell you that I am constantly under urology's care. I've had multiple tests, and they understand all my problems. And the thing is that I have kept track of all my labs, and I have never not, it's always E. coli, and I'm always sensitive to the two medicines that I can take. So why don't they use that kind of statistical analysis to say, okay, we know this about her, and I understand that's not normal practice. So I will talk to urology and see if they can say it's okay to give her medicine when she's sick.
I think that's the right move. I think that'd be the safest thing to work it that way. Yes, ma'am.
Okay, thank you.
Thank you very much, Loretta. Just a quick update because we know we've had several questions on community care. So, Melissa, if you'd like to.
Yeah, I just wanted to let you guys know, Richard and Gary, I was looking at both your guys' information, and one of your referrals was sent this morning, and the other one was sent on March 17th. So you can go ahead and call to get those scheduled. So we are truly working really hard, and both of yours are done.
That's wonderful, Melissa, and I think that's indicative of the service that we're trying to restore in community care. So thanks all. I think we're almost at the top of the hour, so that is all the time we have for questions today. We really appreciate everybody who stayed on the line with us over the last hour. If we didn't get to your question, you'll have an opportunity to leave a voicemail. We do review all of those voicemails and work hard to try to get back to folks as we can. We just want to send a reminder that if you or somebody you know is looking for work and wants to serve veterans, please refer them to USA Jobs or ask them to inquire with our Human Resources Department. Again, 608-256-1901, extension 17483. Thank you all very much for joining us today. Please look out for future town halls on new topics, and we look forward to talking to you soon. Thanks so much.